Wrong use of antibiotics can cause resistance. So if you're getting sick with the flu shot that much, can you imagine how much sick you would be with the actual flu? Okay, I can't afford this much. Can you bill for maybe 10 tablets and let me know how much I have to pay?
A person is getting sick, or can they directly come to pharmacy rather than going into walk-in clinics?
In Canada, until recently, it was a degree holder like B Pharmacy, Bachelor of Pharmacy. Now it's a Doctor of Pharmacy requirement. And also, pharmacists in Canada are the most accessible healthcare professionals.
Hello, Namaste, Sat Sri Akal. Welcome to Diversify, a podcast series by Punjab Live TV Canada. मैं हूँ once again आप सबकी दोस्त, and today we have a very special guest with over 17 years of experience in the pharmacy, a Sheril Cyriac.
Hello. Hi everyone.
Welcome to our show. We are so honored to have you here.
Oh, thank you.
Oh, we have always wondered, there's so many things in the pharmacy that we are not aware of as a customers or as a regular patients. So what we want is today that our viewers get to know what are the programs that they can benefit from, or even if someone who wants to become a pharmacist, so how can they become it, or what's the procedure behind it? Because pharmacy here in Canada is very different than back home.
Correct.
So if you are one ever have visited in the pharmacy, make sure you stay till the end and watch this episode. Let's start with what is pharmacist? Like, what are their roles and what they do?
Okay, so pharmacist in Canada is a protected title. Only people who are registered with the College of Pharmacists in their own province can use that term pharmacist with their name. So it's a really protected profession, and to get to that stage you have many hurdles to pass before you can call yourself a pharmacist. So myself, I am an internationally trained pharmacist, meaning I got my degree from India. And then when I came here, I had to go through all the steps before I could register as a licensed pharmacist. So because you're a pharmacist, you have in the pharmacy, you can operate a certain way. You have your rights and privileges, which only pharmacists can do. So that's a pharmacist in Canada.
And you have been working currently in Thomson General Hospital, right? And before that, you had your own pharmacy as well.
Right.
So tell us that how you, along with healthcare workers, work around to help the patients.
The hospital practice and community pharmacy is a completely different ball game. Okay. Both operate completely differently. So in the hospital, you are only responsible to provide medication to the inpatients or people who are admitted in the hospital, plus the emergency. There are people who are going through the emergency, so we take care of some of their prescription needs. So that's one thing in the hospital. But in the community pharmacy, you deal with a lot of people who are walk-ins, your regular clients. So that practice is completely different. So both has two different scopes, and depending on what you prefer, one person may prefer working in the hospital and the other person may prefer working in the community pharmacy.
So how the pharmacy here is different than our back home, because back home we just go into pharmacy, we show them the receipt, or sometimes if we are just feeling like we have fever, we just tell them and they give us medicines at some of the places. So how the pharmacy is different here?
Here, pharmacy is a very regulated profession. So there's a clear distinction between over-the-counter and prescription medications. Over-the-counter medications means anything that's available on the other side of the counter. You can go and choose, and that is over-the-counter medications. You don't need prescriptions for that. But however, you can ask your pharmacist's advice to help you choose one for your condition. There's also behind the counter stuff which you may not see outside, but if you need like iron, for example, iron tablets, they're not prescription, but they're behind the counter. You'll need to go talk to a pharmacist or somebody in the pharmacy to actually access it. And the last class is the actual prescription drugs, which you need a prescription from a doctor to access. And that prescription you bring to the pharmacy, and the pharmacist reviews it and then gives it to the patient if everything is correct. And then the pharmacist also advises the patient on how to use it, what are the side effects, what all restrictions, or what all food and beverages you have to stick to while you're taking that medication, monitoring what you need to go for blood work, stuff like that. They advise on that. That's called counseling for a medication. In India, it's a bit different in the sense that in India, you can actually, if you know the name of your medication, you can go and request your pharmacist to give you that medication. They really don't insist on having a prescription. Also, some of the narcotic medication, of course, it's restricted, but most of the other medications you can access it without a prescription. But the over-the-counter stuff, I think it's kind of the same. You go ask your pharmacist in India and they'll give you whatever is required for your symptoms. But the main difference is in India, when you go to a community pharmacy, the person who's serving you is a diploma holder. So he or she most probably only will have a 2-year diploma education in pharmacy. Whereas in Canada, until recently, it was a degree holder like B Pharmacy, Bachelor of Pharmacy. Now it's a Doctor of Pharmacy requirement to be a pharmacist. So every person who's getting into pharmacy practice these days, they need to have a Doctor of Pharmacy. So the number of years that you spend studying to become a pharmacist is quite different here.
And you also mentioned over the counter. So can you explain a little bit for our viewers what does over the counter means?
Over the counter means anything that you will see on the other side of the pharmacy counter. Like you don't have to ask anybody, anything that you see open on the aisles, like Tylenol, Advil, vitamins, stuff like that. Anything that you can see on the other side which is open to the public, that is over the counter.
So you can pick it up and go.
Yeah.
And you also mentioned, in India, there are only few medicines which are restricted. But we also see like antibiotics, let's say. So it's easier to get in India because I think they are also not, they
regulated.
don't require prescription. But in Canada, it's very different.
Yes. So yeah, as I said, the over-the-counter medication, free access to anybody. Behind the counter is a little bit more restricted, and anything with prescription is really restricted. Then you need to go through a doctor first, or any certified healthcare professional who can prescribe, like a nurse practitioner, doctor. Sometimes your pharmacist can prescribe for you. So you have to first go through them, then only you'll have access to the prescription medication. So that antibiotics is one of them, of course, because wrong use of antibiotics can cause resistance, and then if you get sick, none of the antibiotics can work on you. So that's why it's restricted.
And so, for example, let's say a person is getting sick, or can they directly come to pharmacy rather than going into walk-in clinic? Or if yes, then in which scenarios they can come to pharmacy?
Yes, they can come to the pharmacy, but it's good to know which ailments the pharmacist can help you with. But definitely, as soon as we see somebody who we cannot help, we refer them to the doctors right away. But if you have like a urinary tract infection, you can go see your pharmacist. So pharmacists who are certified to prescribe for urinary tract infection, uncomplicated, and if they have had it a couple of times before, then we can prescribe medications for that. Then there's smoking cessation. Like if you're a smoker, you're thinking of quitting smoking, you needed prescriptions for that, we can help with that. And then there's minor ailments. There's a whole bunch of stuff like red eye, there's eczema, there is what else is there, athlete's foot, like a lot of minor ailments which you can get prescription from your pharmacist.
think that's good to know, because there's these things we were not aware of. Then, because what happens is, a lot of times, if it's a weekday, it's okay, but on weekends, a lot of walk-in clinics are closed, especially on Sunday.
Right.
So then, if we knew that, okay, we have these kind of conditions, we can actually go to pharmacy, because pharmacy is open all 7 days.
Right, yeah.
Most of them.
Yeah.
So that would help a lot.
And also, pharmacists in Canada are the most accessible healthcare professionals. So if you're not sure, you can pick up your phone and actually call and check, I'm having this situation, what can I do? And I'm sure your pharmacist would be able to guide you wherever you need to go see. Or there's also now these online consultation with doctors, so that's also an option if walk-in clinics are closed.
And also, if you are ever thinking of quitting smoking, as you said, so just take your car keys and just go directly to the pharmacist, because sometimes you wait for an appointment for a doctor and then you change your mind.
True.
So this would be a perfect thing to just go directly.
Yeah.
And how about the flu shots? Like, we have heard there are so many flu shots, but as an immigrant, sometimes we are not aware of that we should get it, or we shouldn't. And then what are the charges included in it? So
yeah, so flu shots usually come out in the fall, end of fall. By end of September, beginning of October, they start rolling out the flu shots. And in Canada, flu shots are very important, because once winter hits, we spend a lot of time inside. So what happens is, whenever you are inside, anybody who's sick, they're circulating their bacteria and viruses all around. So then you're more prone to getting sick than when you in summer, when you're outside. So getting flu shot is very important, because then you're being subjected over and over and over to these bacteria or viruses, and then you don't know what kind it is. So flu shots help you prevent a majority of the popular circulating causative flu organisms. So that is a good idea. And also COVID shot, because COVID is still there, we are not testing, so a lot of people don't know if they have COVID or the flu. So while you're getting a flu shot, it's also good to get your COVID shot. Now, flu shot is free of charge. You don't need to pay. You just need to make an appointment with your pharmacy, and then at the same time, you can get the latest COVID shot also. I'll give you an example. I was traveling recently. Luckily, I'd gotten my shots before I traveled, and in the plane, like almost 80% of the people were coughing and sneezing and all that. And coming back, some of my friends that I traveled with, they all got sick, but I was not sick, and I was happy that I got my flu shot.
And so everyone should take flu shot, as you recommend.
It's highly recommended. Yes,
recommended. Yeah. Okay, because a lot of people say that after getting a shot, they are getting sick. So they feel like, it's lowering down your immunity.
No, after getting a flu shot, you might feel sick for the first couple of hours, or some people for a day. It's just your body working to build your immunity. It's not actually you getting sick. So if you're getting sick with the flu shot that much, can you imagine how much sick you would be with the actual flu? So this is just your body fighting, or getting boosted, so you can fight against the flu viruses when they come. So that's not true that flu shot makes you sick. It's just that your body is getting ready to actually fight flu when it actually happens.
And powers of pharmacists have been recently expanded. So can you explain a little bit to our viewers?
Yeah, so in the beginning, pharmacists were only allowed to sign off on medication, talk about medication, counsel medication, stuff like that. But after that, when they found the value that pharmacists are the most accessible healthcare professional, they added, the first thing they added was the shots, vaccinations. So it started off with flu shots. And then when COVID came around, they found the value value in that as well, because people could get access right away. So they expanded COVID shots. And then after that, they expanded the prescribing authority so that people don't have to wait in line for minor ailments, or as I said, urinary tract infections and stuff like that. But in Saskatchewan, pharmacists can also prescribe for strep throat now. They can do a point of care testing, and if the test becomes positive, they can prescribe. So each province has their own regulations, and slowly one province will see, oh, that's that's adding value to the healthcare services, and then they expand the scope for pharmacists. So hopefully strep throat prescribing also will be here in Manitoba soon for pharmacists.
And there's also a person, this is pharmacist assistant, right? What do exactly they do? Because sometimes what happens is we go to pharmacy and pharmacist is not available, so then they tell us to come back or to wait. So what's their role exactly?
Okay, so I just need to correct you there, because a community pharmacy cannot be open if a pharmacist is not present physically. So you'll never see a situation where you go in and the pharmacist is not there. Yes, they might be there, but they might be busy to actually give you a consult. So that's why they're asking you to come back. But if a pharmacist is not physically present, we cannot open the pharmacy. So that's the rule in Canada. So say if the pharmacist is sick, they have to close that pharmacy and wait for a replacement to come. That's how it works. So you'll never find a day where a pharmacy is open and a pharmacist is not physically present. That's against the law. And about staffing, there's 3 different staffing roles in pharmacies. The first, of course, pharmacists need to be present at all time when the pharmacy is open. The second role is a pharmacy technician. This is actually again a protected title. They're also registered with the College of Pharmacists as registered technicians. So only those people who are registered, they can be called technician, pharmacy technician. They help the pharmacist in checking for products. They can take some transfers when a pharmacy's prescription is being transferred out. They can actually do that or receive a transfer, and they can check products, but they cannot sign off on new prescriptions or check for drug interaction or counsel patients. They can help with everything else, the technical aspects, like product checking. For example, they can make sure that the correct product is being filled and the correct product is in the bottle, stuff like that. So that's a pharmacy technician. And the last one is the pharmacy assistant. That is not a protected title. Anybody with training can be a pharmacy assistant. So they can help with showing people where stuff is, receiving prescriptions, typing, putting away stock, counting, anything else, answering phones, creating a profile, stuff like that. Anything else the assistant can do. So those are the 3 positions that you'll find in a pharmacy.
And we also feel like sometimes, the prescription medicine, if it's expensive, but we just have to make sure that, we check our insurance. And a lot of pharmacies do take, they do directly bill to insurance, right?
Yes.
So this is also very helpful. Like, is it all the pharmacies, they do that, or it's some of them?
Yeah, you cannot operate a community pharmacy these days without directly billing, because it's a great inconvenience if you're not doing direct billing. So I think, as far as I know, all pharmacies are set up for direct billing. So what you need to do is you just present your insurance, and they can enter it, they can check and see if it's covered or not. Then they'll let you know if it's covered or how much your insurance covers and what the rest that you'll have to pay and stuff like that.
This actually can, really helpful for the viewers, because they can now make sure that they have insurance on their phone, just card, and then they can
Right, yeah. Or if you have any questions, you just bring your card to the pharmacy and say, this is my prescription, can you run it through and let me know how much I have to pay? And then say it's because money is money. Ultimately, you need to present the money to get your product, right? So if you can't afford it, you can ask them, okay, I can't afford this much, can you bill for maybe 10 tablets and let me know how much I have to pay? So everybody understands that, and you just have to be bold enough, not bold enough, open enough to ask that, and I'm sure they'll be helpful.
Yeah. I think every every challenge has a solution, but we have to ask
Of
first.
course, yes.
So,
Yeah, don't be afraid to ask, and it's your right as a patient, right? Because it's a service that you're paying for. So ultimately, it's your right to choose if you want 90 tablets, if it's an expensive product, 10 tablets, whatever you can afford, right?
and is there any pharmacare program that benefits a regular public if they don't have insurance or?
That's a complicated question. Pharmacare is there for all patients, but there's something called deductible. So each province has a different way of coverage. It's the public insurance. Each province has different ways of covering. But in Manitoba, if you're a working person and if you make like a decent amount of money, I don't know how much, maybe say your annual income is like 50,000, then you have to pay a deductible first. So depending on your income, you have a deductible for pharmacare. So whatever money you have your deductible set, you have to first pay that. You have to first reach that deductible. After that, whatever is going to be your expense will be paid for by Manitoba Pharmacare. But for a regular working person, it's hard to reach the deductible because husband and wife, they'll both be working. So say your income is close to 100,000 combined, so your deductible is probably going to be, I'm just going to say maybe 7,000 or something. So you'll have to first buy $7,000 worth of medication in that year, and after the 7,000 whatever is there, then that will be covered if it's a benefit under pharmacare. So that's the one option. The second option is the welfare, people who are on social assistance. So they have free prescription drug coverage. So then you just have to let them know that you're on welfare, and then we put it under that plan, and then it runs through automatically. So those are the two public options. Yeah.
Okay, perfect. And now this is, for the newcomers, if they want to become pharmacy, let's say like they were, back home, they were working in a pharmacy and now they want to become pharmacist because it's also a very good profession, well, money as well. So how do they become it? Like, what's the process for them?
Okay, so first you have to check with the College of Pharmacists. You have to first register with whichever licensing body is in your province first, and then the next thing, the body for the exams is called Pharmacy Examining Board of Canada, PBC. So they are the ones who actually regulate all the exams and all that. So you need to create a file with them. Before that, you need to have your credentials verified. So there's a different body for that. So first you register with that body, and then you have to send all your transcripts and everything. What they do is they make sure that your degree is equivalent to whatever they offer here. So first they do a degree equivalency. They'll compare your transcripts and everything, and if it's equivalent, then they'll say there's a registration fees for it. I think it's about $400. There's a fee for everything. So then first you pay that fee, you send your transcripts in, you send all your certifications from India there, and then they look at your credentials and they say, okay, fine, your degree is good, you can now go ahead and write the exam. So first they have to let you know that. The next step is there's mainly 3 exams. One is called the evaluating exam, and then there's 2 other exams, qualifying exams. So then you apply to the PBC, and then you pay your fee. I think it's around $750, if I'm not mistaken, around $700. So that's the first exam. You prepare for the first exam, you pass that exam. Now they have exempt certain countries from giving that first exam because there's such a shortage of pharmacists. In India, there's only one college that is in the list, and that is JSS College of Pharmacy from Ooty, I think, or Mysore, one of the JSS colleges. So anybody who's graduated from there, they don't have to do the first exam. They are exempt for a certain period of time. But also people from UK, Australia, certain countries. Those countries, they don't have to give that first exam. Anyway, the first exam, you pass that, and then you go on to the next exam, which is the qualifying exam part 1, which is like a computer based exam. Even the first qualifying exam is a computer based exam. So again, the fee is around $750. Then you first pass the qualifying exam, and then you go for the qualifying exam part 2. This is like a practical exam where you interact with patients. So that one is I think $1,500, that the fee. And then once you pass that, then there's also a jurisprudence for each province that you practice in. There's a law exam, so you pass that, then you pass your English, and then you're ready to be registered as a pharmacist. Also, there's some period of internship and all that. But what I've seen, I have one thing to say. What I've seen in newcomers is that, you know, they hesitate to take the exam, and they've heard so much that it's so hard. You know, like nothing is hard. You just have to put in the work and at least try it. You know, don't even not try it and say it's hard. You have to give it a try. But at the same time, you only get 3 chances. After 3 chances, you can never try the exam again. So make sure you use your chances wisely, prepare well, and give it a try, because, you know, it's a very fulfilling and very respected profession. People always appreciate you and respect you for your knowledge, and at the end of the day, you go home satisfied with your work.
Think that's so wonderful knowledge, because, you know, even back home, if you're studying anything like UPSC or CA, you have to put a lot of efforts while studying an exam.
Yeah.
So it's kind of similar.
It's not unachievable, because if I can do it, I came from India, anybody else can do it. It's just that you need to work and for anything you need to put in work, right?
And what do you think are the challenges that pharmacists face, like sometimes when patients are coming? So what do you think, like what challenges you face?
Well, the most crucial is burnout from work, because there's a lot of work pressure. A lot of things are dependent on you, and it's hard to find pharmacists to replace. So that burnout is one of the main things. And then usually most community pharmacies are busy, they're understaffed. So, you know, there's a lot of demand. So, you know, your work day is pretty stressful. So I think you need that work-life balance quite a bit to be able to consistently perform. Other than that, it's like everything else. Yeah.
Thank you so much for being on the show. Our viewers would definitely get so many information from you. Like you shared very good knowledge. So that was Sheril. She shared her 17 years of experience being pharmacist. And now we want one help from you. Make sure you comment down what more topics you want to hear, and we'll bring more guests to you. So, and this is Payal signing off, and you keep watching Punjab Live TV Canada. Bye.